range of motion. We know that early joint range of motion is really, really important to support reductions in pain, improve swelling removal, to prevent joint stiffness as well. And so by doing early joint range of motion, you can avoid capsular contractions, reduce pain, swelling, and it seems to have no adverse effect on joint laxity. So we need to be getting them, and this is pretty commonplace now. We're all doing range of motion exercises very early. But if you don't recover joint range of motion, it has a massive impact on your subsequent rehab. So one of the first goals of early stage rehab is we need good range of motion. We need full extension as quick as possible, and we need good range of motion in flexion, ideally to about 120 degrees really by the end of early stage. So the pool is a really beneficial environment for supporting range of motion recovery. And one of the reasons is hydrostatic pressure. So that supports swelling removal. And you can only get good range of motion if you don't have large amounts of swelling. So often in the gym, we're trying to do active and passive range of motion, but there's a lot of swelling there. You immerse someone into water, you get rid of the swelling, edema removal. That will allow you to then get improved joint range of motion. So often you can achieve higher or increased active and passive range of motion following immersion in water as well. So doing your range of motion tasks, first get rid of the swelling, then go into the range of motion tasks. And that's not always done clinically. Water also desensitizes the area. So if you have a particular pain level of, say, 3 on land, it's probably going to be around 1 in water. That's because immersion will desensitize the injured area. Pain is less well perceived. The pain threshold's elevated in the pool. And this is something important to consider because you can't really use pain as an indicator of task progressions. We're going, okay, do you feel it? Does it hurt? Are you in pain? But what it can do is it can be used to desensitize an area, particularly in patients who have apprehension, may not be achieving certain range of motion due to fear and pain. And so we can desensitize the area, we can get rid of swelling, edema, and then that allows us to achieve greater range of motion passively and actively than we would have on land. So sometimes, even if it's activities we'll be doing on land, by immersing them in water, desensitizing the area and reducing edema, we can then achieve greater range of motion. And achieving greater range of motion speeds up that recovery process. So secondly is recovery of normal gait cycle. So again, probably quite a well-known aspect of hydrotherapy. And what we know is the restoration of walking gait's a priority. We need to, in most serious lower limb injuries, there's some gait issues. You injure the knee, there's range of motion restrictions, there's pain, there's an offload, there's reduced ability to accept load through that joint. That's going to impact your ability to walk without crutches, and then that will impact gait. And we know that gait alterations will happen post ACL reconstruction, and if not appropriately addressed, gait alterations at week 4 will negatively impact the ability to then run by 12 weeks also. So you need to restore these gait alterations. And what we know is sometimes there's a restriction in joint loading on land, so someone can only maybe put 60% body weight through the joint, hence they need crutches, hence they have to find a compensation strategy. So faulty gait patterns can sometimes emerge, and re-establishing normal gait is important. And because of the properties of buoyancy and relative density, you immerse someone in the water, they can't load on land, but actually now, because you've immersed them up to, say, chest height or belly button height, then you're actually going to now allow them to be able to appropriately walk, because now their capacity to load is aligned to the loading within the water. So now they can only load 50% body weight through the knee, but actually you've put them in an environment where that's sufficient to allow full walking pattern. So you can start to basically restore gait quite early. So if someone's on crutches at week 2, week 3, which they will be, then you can immerse them in the water and you can preserve their gait. So once they're off crutches, you've managed to maintain that, and hopefully no faulty gait patterns have emerged. Thirdly, probably less well known, is the maintenance and development of cardiovascular fitness. So restoring aerobic fitness is a really important part of injury reconditioning. And this is the same for any athlete, whether you're a recreational athlete, whether you're even a sedentary person. We know that VO2 max is actually the most important physiological attribute and an indicator of longevity and health in a lifespan. So actually VO2 max is your key indicator of a long, healthy life. So everybody needs good aerobic fitness anyway. But Restoring or preserving aerobic fitness in your elite level athletes is vitally important. They spend a number of years and developing their cardiovascular fitness, and if the more we allow it to drop, the longer it's going to take to recover. And there's very limited research, but what we do know is professional footballers at 6 months post ACL reconstruction still have a large deficit in VO2 max or aerobic fitness, about a 10 to 15% reduction. So if you have that reduction in VO2 max, that is going to take time to fully recover. And athletes, in my opinion, should be going back to play fitter, stronger, more robust than they were before the injury, not at a lower level of fitness. Deep water running is a really good tool for preserving and developing aerobic fitness. So again, we've got the viscosity of running, we've got the viscosity of the pool, you've got your buoyancy, you've got your density, which means that you can immerse someone in a pool. They won't be running and having the high impact forces associated with running. So to be able to run, you've got to have every single step in running is 2 to 3 times body weight. So people can't experience that until about 12, 14 weeks post ACL reconstruction, optimally. But you can immerse them in water, you can do deep water running, you won't get the impacts associated with ground contacts, but what you can do is you can get a very similar cardiovascular response to running in the water as you can running on land. So treadmill-based running or running in water in healthy individuals and not elite level athletes elicits the same cardiovascular demands and the same adaptations. So this has been used in the military, and it's been shown that deep water running can improve VO2 max running performance. It's also in sedentary individuals, you can experience about a 12 to 40% improvement in their VO2 max, whilst you can maintain VO2 max in your elite level athletes. You can't really develop it in your elite level athletes, but deep water running and the use of the pool is not about enhancing cardiovascular fitness. It's about minimizing the deficits in fitness. So when they do go back more towards mid, late stage rehab, return to sport training, you're actually looking to develop their endurance capacities, not restore it. Considerations is that your heart rate is typically lower in water than on land. And so you need to adjust those boundaries. You might see, okay, 140 on land, 140 in the water, but that's actually, that person's working relatively harder. And so there's not a huge amount of options for monitoring the heart rate. There are some devices that do allow you to monitor heart rate whilst in the pool. But it's important, in my opinion, to monitor the cardiovascular response. But when you're looking at your prescriptions, your heart rate zones, you need to just adjust those heart rate zones for the impact of the cardiovascular responses in the pool. You also need to, when doing deep water running, ensure optimal technique. And this goes with any movement tasks you're doing in the pool, because your focus is to try to restore gait or try to improve motor patterning or try to preserve running gait. So you need to make sure that there's an effective technique when performing it. And if you're doing your deep water running with good technique, there's no research of my understanding, but that's more likely to then support preservations of running gait as we introduce them back into running on land. But obviously you're trying to get good technique. So when you're teaching them, you want, and this again, refer back to my practical, because in the practical, I coach these points as part of that practical. But we want to get optimal hip flexion, extension, arm positioning. You want to make sure you're getting that simultaneous knee and hip extension. You want to make sure that they're hitting or pretending they're hitting the floor. So you're getting that ground contact, and then you're going into hip extension. What you don't want to do is it to turn into a very upright run. Although you can do that, it's not going to be as effective.